Stay with us, though. After the break, we're going to have a chat to a couple of guys who have invented an app which allows us to take our medical records with us anywhere in the world. That's up next.
Alan Hickey on 1395, Adelaide's 5AA.
23 minutes away from 1 o'clock. Are you heading off on holidays this Christmas? Lucky you. Have you got any medical issues? Well, I'd suggest you better take your medications with you as always, and your prescriptions perhaps, or you could simply take a new app on your smartphone. Yes, technology has caught up with us in every way, hasn't it? MediTracker is a new patient app which helps us stay in touch with our GP no matter where we are in the world. Now, the man behind it is with me at the moment. A very good afternoon to Professor Michael Georgeff. How are you?
Good afternoon, Alan.
Good to see you. How did how does it work? Firstly, how does the app work?
Yes, in one sense, it's very simple. It's what it does. It connects the patient directly to their GP practice software, and we extract from that practice software a summary of the GP's medical records. So that means on your mobile phone, you've got all your medications, you've got all your problem history, pathology results, measurements. So everything you need, for example, if you went into an emergency, stand on a rusty nail, don't know what your last immunisation was. So it's all there on your phone and it's always up to date.
And I guess the advantage of it being on an electronic app on your smartphone, it will operate anywhere in the world as long as you've got a signal.
Yeah, it operates anywhere in the world. And even if you don't have a signal, it keeps the data locally. So it'll always have your latest data. Every time you go to your GP, it'll refresh it. So it doesn't matter even if you're out of internet range, it still works.
That's interesting. I wasn't aware of that. So it actually downloads the data to the card on your phone.
Yeah.
Why did you find this was necessary? Where did the idea come from?
So we have for a long time been developing applications for GPs for patients with chronic illness. We started getting messages from our patients saying, this has saved our life because we could log into your system as a patient. We went into hospital. It saved my husband's life twice because we've told him what drugs he was on. It's changed his mental health. He can now travel and visit his grandchildren. And they said, why don't you put it on an app so it's more usable than, having to lug around a computer to log in. So that's what drove it.
Fantastic. It's such a simple theory, isn't it? But I guess it took a little bit more than that to actually put it together. We're also joined by Dr. Darren Barnett, who's a GP here in Adelaide. Darren, you've actually got patients using the MediTracker right now.
Yes, yeah. Over the last probably 2 months, I've got somewhere between 12 and 15 patients who have, initially some of them were trialling it, and now I've got several extras who've joined to use it, and already getting very positive feedback about the easy access to their information. Some of them travel quite regularly, and the easy access when you're at a specialist appointment and you want to check what medications you're on, instead of having to carry a bag of medications, grabbing out your phone and the specialist having a check that, yes, what I think you're on is what you think you're on and what your doctor thinks you're on, has proven to work really well.
Look, and that is a real issue, isn't it? Because how many times do you go along for a test or whatever, they say, what medications are you on? And you think, crikey, I don't know. I'm on something for cholesterol, I'm on something for blood pressure, but I don't know exactly what.
Yeah, it happens very regularly, and this software will help solve a lot of those problems because people will be able to very easily check and even double check. So if I think you're taking a medication and you're not taking it, then it's a much easier way of checking that. I've actually been in the habit up until now of once every year or two getting patients on lots of medications to bring their actual boxes of medications in for me to double check. And that's much less necessary with this sort of software.
As I said in my opening comments, Michael, if you go away, you should probably take your prescriptions with you if you're on medication. This would alleviate the need to take a paper copy because I've got effectively an electronic copy.
Look, I think if you're in Australia, you'd still need to get your prescription fulfilled. You'd probably need to have someone fax the prescription because the prescription itself is not sitting there. But in an emergency, you go into an emergency department in the hospital, you don't need a prescription. If you're overseas, the same thing, you don't need a prescription. So It won't help you for your conventional stuff because the prescription's not sitting there. But
I'd assume this would also be particularly important for people who are chronically ill and are living with a chronic illness.
Yeah, so one other feature of the app is that it lets the patient select their care team. So if you're chronically ill with diabetes, for example, you need to see podiatrists, optometrists and whatever. So the app lets you select all your care team, and then you form a little private network with this care team, and you can share your medical record. It connects to all the devices you've got at home, like blood glucose meters or blood pressure, and you can share all that data with your care team in a completely private, contained way.
Really is quite complete. A closed loop system, isn't it?
Yeah, it's somewhat like friends on Facebook.
Yeah.
You form this little team, and then you're closely connected to manage your disease. Whereas currently, if you've got a chronic illness, you go from one provider to the other. No one knows what the other one's doing. So
exactly.
Problems
happen. What about security? Can we be assured that our details are secure?
Yeah, absolutely. Obviously, we've gone through. We do a number of projects for the government, all using the same technology. The security's, rock solid security, and even for the patient to access it, you have to go through a whole lot of.
Oh, do you? Okay.
Annoying steps in a way.
Good. It's not just a simple fingerprint. Darren, back to you. In the past, you've been using My Health Record.
Yes.
How does this stack up?
Much more user-friendly. For My Health Record, I guess we've still got some lingering concerns regarding security, and the information that goes on My Health Record, you need to have internet access and a computer and a person who's logged in and able to use My Health Record to access that data. So for a lot of the public hospitals, I can literally say I've not once seen any useful interaction with My Health Record.
Is that right?
And I would have probably 50 patients who've got a My Health Record, quite a few with chronic illnesses. I specifically, when I was setting up people for My Health Record, chose those patients who travel and the patients who were more likely to need access to their data, and several years down the track, still not one who's made any useful interaction with it.
That's interesting, isn't it? Yeah. All right. How do I go about signing up, Michael?
Right. It's very easy. You just go to the App Store, download the app. It's called MediTracker.
MediTracker, all one word.
All one word. Download the app. You can also go to the web page with meditracker.com.au and read a bit about it, see a video. You just download the app. You have to enter in a whole lot of information about your GP practice so we can connect you, and we do a few security checks. And that's it. So the only issue is whether your GP practice has enrolled.
Right, and that was what I was getting to. I have to convince my GP that this is a good idea from his or her point of view as well.
Yes.
Do I? So should I speak to my GP first?
Look, it's a good idea to download the app first, because if you try to connect, it'll tell you, well, your GP is already connected.
Oh, okay, yeah.
So you don't have to bother talking to them. But if they, when you try and connect, if it doesn't, then the next step is go and talk to your GP or tell us, and then we'll talk to your GP.
How many GPs have you got signed up thus far?
Look, across Adelaide, I think we've got about 15 or so. Yeah, you've signed up.
Okay.
Yeah, 15 practices.
Early days.
Yeah.
Early days.
Very much early days.
You're only launching that this week, aren't you?
Apart from Darren.
Yeah.
We're only launching it this week. Yeah. So the more we would encourage GPs. It's free for GPs. It improves patient safety, as Darren has said. It takes them a minute to connect in. So it's trivial for them to do it, and they can try it. If they don't like it, they can always turn it off.
They can turn off. Yeah, absolutely. Listen, congratulations. What's your background? How come you went down this path?
So my background actually is in IT and artificial intelligence, but then, and that was mainly in the US. Then I came back to Australia. Saw healthcare with everyone standing around faxes all the time.
Yeah.
Wondering what's going on here. And, Australia's got a fantastic reputation globally in healthcare. So by putting some information technology and some smart stuff into healthcare, we can become world leaders in this area. And we already, Flinders has got great stuff going on. So it's a great opportunity for Australia to be doing this sort of stuff.
You raised the point, you came back and you saw people standing around fax machines. That's so true. Why do we still rely on fax machines so much, Darren? Why not email?
Security. Email's not secure enough in a lot of cases.
It's purely and simply, if you've got the paper copy in your hand, you know it's gone through.
Well, you know it's gone through, and you also know that it's gone from whoever sent it to you as the recipient.
Right.
Whereas the email gets stored often on an email server where you can't be certain who can access that. So for confidential health information, we want to know that it goes from point A to point B without any interception possible.
Because specialist offices and doctor surgeries must be one of the few organisations in the world that still have fax machines. It's amazing, isn't it?
We use our fax a lot of the time.
Absolutely, yeah. Well, listen, so the best thing, Michael, MediTracker.com.au.
Yes, or else just download from the App Store.
From the App Store.
Either one, Google or...
Fantastic. Well, congratulations with it. It's a great initiative, and particularly heading into the holiday season, something to certainly give a try over the holiday period when you're going down the beach for camping for a week. Or something.
Yes.
Or somewhere. Thanks very much, gentlemen. All the best. Thanks for coming in. So that's MediTracker.com.au.